Well, the really kind of disturbing thing is that you can pretty much lose all the soft bits of your face. As long as the brain is protected, like the body will continue on some level. So some of these men were certainly facing, extreme disfigurement. And in walks Gillies, and he becomes this perfect vessel for this challenge because
It's truly something special because we're joined by one of the most captivating voices in the world of medical storytelling, Dr. Lindsey Fitzharris. Dr. Fitzharris is a renowned medical historian with a PhD from Oxford, a New York Times best-selling author, and a master at bringing the hidden, mysterious, and sometimes unbelievable history of medicine to life. You may know her from her groundbreaking books, The Facemaker and The Butchering Art, works that have transformed how we understand surgery, innovation, the human stories behind medical progress. Beyond the page, she's also a television host, leading the Smithsonian Channel series The Curious Life and Death of, and her writing has appeared in some of the most prestigious outlets in the world, including The Lancet, The Wall Street Journal, The Guardian, Scientific American, and New Scientist. And in case you missed it, her 2019 appearance on the Joe Rogan Experience became a phenomenon, reaching #1 on the Chartable rankings with millions of downloads in the very first week. In this conversation, we go far beyond her remarkable career. We talk about her journey to becoming a best-selling author, dive into some of the most haunting and fascinating stories in the history of medicine, and hear her reflections on her personal experience with breast cancer. We also explore the incredible partnership she shares with her husband and its complementary talents, her exciting new venture into children's books, and even the possibility of one of her works making its way to the big screen. This is a rich, heartfelt, and unforgettable episode at the intersection of medicine, history, storytelling, and humanity. So settle in and let's dive in. Welcome to another episode of the DIEP End. I'm Saeed. I'm joined by my co-host,
Hank Davis.
Yeah, and we have a very awesome, really special guest for innumerable reasons to mention. I think the top of that list is the fact that a very close mentor of mine, Aaron Warman, absolutely adored her and her work, and was the last person to actually connect me with Dr. Lindsey Fitzharris before he passed. But hopefully, we're looking forward to welcoming Dr. Fitzharris at some point to Penn for an in-person talk. But I told her that we don't typically do introductions, but she's more than deserving. So not only is she a medical historian, not a real doctor, but a medical historian, but she has a PhD from Oxford, a TV host, New York Times best-selling author by two of my absolute favorite books, Butchering Art, The Facemaker, which we'll talk about today. Her husband, Adrian Teal, is an absolute talent, and I can't wait to mention that. She hosts the Smithsonian Channel, The Curious Life and Death of. I mean, she's a writer for the Wall Street Journal, Scientific American, Lancet. It appears all across social media. You have to check out all of her work. She was so kind to send me these two books in the mail recently, and which we'll talk about. But before we dive in today, I want to show you this. So my realtor sent me an email 2 weeks ago, and she goes, one of my previous clients sent me this in the mail, and I wasn't sure if you would want it. So this is I don't know if you can see it, but that's Joseph Lister. And it says, yes, it's written by him. And it's so amazing to read this from back in the day. So it says, "Dear White Cooker, I am very much obliged to ask for your kindness in asking me to meet Sir Richard Owen tomorrow. But unfortunately, I have a previous engagement for the evening. Believe me, yours very sincerely, Joseph Lister." So I thought
That's
it was
amazing.
but I love the way that they used to write and talk. And
he was a Quaker, and one of the challenges with the butchering art was he actually comes across a bit boring. When you compare him to Harold Gillies in The Facemaker, who's really a prankster, and he's got this really big personality. Lister was he was very somber. He was very, devoted to God. That was a big part of what he was doing. In fact, at one point, he almost leaves medicine. He gets very ill. He has a mental breakdown, and his father really talks him back into it. And thank goodness, right? Because he changed everything. But it's hard to sometimes get a sense of people's personality in the 19th century because of the way they speak, and they don't really let loose.
It's like
in the way that
formal.
we
It's
would.
like always
Yeah.
formal.
Yeah.
Yeah. I mean,
Yeah,
we were talking earlier about William Halstead. I mean, you do get a sense of a personality with him in the 19th century. I
definitely.
mean, just such a crazy character. And if you don't know who he is, you need to check out the book, Genius on the Edge, which I
Yes.
didn't write, but it is a fantastic book. But so there are bombastic characters, but Lister, what attracted me to him really was that he's kind of the sober character amongst these showmen because he comes into surgery in the pre-anesthetic age, and the book opens with this famous surgery in London, the first surgery under ether. Now,
Mhm.
this was done first in America, but then it quickly got to England. And it's done by a guy named Robert Liston, who's this really big character
Six
in the
foot
past.
two.
6'2". I know. I always make a big deal about this, and people are like, "Why are you obsessed with his height?" But I mean, that was
That was
tall.
big for the
That was
time.
tall
Yeah.
back. And he was strong, and he could hold you down with his left arm, and he could take off your leg in under 30 seconds. And that's what you
Crazy.
want in a pre-anesthetic era. And he was a showman. I mean, he would hold the bloody knives in his teeth, and I mean, it was a gross, disgusting time. And what I loved about that scene was that there was a 17-year-old Joseph Lister in the audience, and I thought if I was
Yes.
writing this would be the opening, because
Yeah.
here you have the dawn of anesthesia. But actually, surgery gets much more dangerous following that because the surgeons are more willing to pick up the knife. They don't understand germs. And then you have 17-year-old Joseph Lister who's going to solve this great mystery.
So crazy.
So, but he's very somber and he's very serious. And I think if a movie was ever made, which is always, the dream, I think that a great way to signal that Lister is kind of winning is that the world gets a bit cleaner. So he
Mhm.
always was dressing in blacks because he was a Quaker and he dressed very somberly. So maybe everybody starts to sort of align. And if you think of Gangs of New York, did you guys ever see that movie?
Yeah.
Yes.
Brilliant, right? And all the crazy outfits, like the stovepipe hats and the crazy tweeds and all, that's how the early Victorians they dressed like that before Victoria plunged them into national mourning. And so I love the idea of like the pre-Lister world being really colorful and kind of outrageous and showman like. And then as you move through that story, it gets a little bit cleaner and a little bit more somber, just like Lister.
Yeah.
Yeah. Well, Joseph Lister, I guess, had that moment of awe when he's sitting in the crowd in the amphitheater. But I want to hear about your story. And, was there any time in your upbringing where, there was a teacher, a book you read, or something you saw or a show that got you first into science and medicine
You're like,
and
what
pursuing your path?
what was the moment that you began? I mean,
Yeah.
unsurprisingly, I was a weird child and I grew up to be an even weirder adult. You guys can kind of see that if you're watching the video. My office is full of weird trinkets and stuff. My parents divorced when I was 4, and my mom, my brother, and I moved in with my grandmother, who loved to just collect. I mean, she was like the family historian. And so I really grew up around a lot of weird objects. I would go into the basement and there would be a trunk with my grandfather's Marine uniform from the Second World War. It looked like he could just walk in and put it on.
Mhm.
And I think I got really interested in history. But the other really important thing was that my grandma was a cemetery goer. And this
Cool.
is something that a lot of people do anymore, but it was really important to her. And we would go to the cemeteries and she would tell me over and over again the same stories about the family. And it used to kind of irritate me, but now I'm so happy because they're ingrained in my soul. I could tell those stories exactly how she would tell those stories. And we would go all over Chicago to these old cemeteries. And I think that, there's a morbid aspect that people probably thought I was a strange child because of that. But I think I was just always fascinated with the people who lived in the past and what did that little dash include, between those dates? What
Yeah.
was about their lives and how did they live and die? And my grandma would tell me stories too. I mean, she had a cousin who died after the cousin was like was only 17 and she was turning the hallway at school and she got knocked with a ruler in her gums
Mhm.
and they got infected and there was no antibiotics and she
Oof.
died. And
It's
and my
crazy.
grandma made a big deal about like she was such a great beauty. And it was like that was like the worst part, like her face.
Yeah.
Yeah.
But not that she died at 17.
I know.
But yeah, it was so she told me all of these great stories that really kind of got me interested in history and I just loved it. And so I went down that path.
It shows you
Yeah.
how, like, influential your surroundings are as a kid. When Hank asked that question, I was just thinking to myself, like, about, like, your upbringing and what really attracted you to all of this. I also have another question just to backtrack a little bit. Robert Liston, I think he was Jack the Ripper. Or you tell us who's Jack the Ripper. I need to find out. We can just let
Well,
the
I'm
world
not
know.
gonna tell you that because my next book, Sleuthhound, is about a surgeon named Joseph Bell, and he taught Conan Doyle, and he really inspired the character of Sherlock Holmes. And in fact, Conan Doyle even outs him. I don't if anybody knows anything about Conan Doyle, he hated Sherlock Holmes. I mean, he really hated him, and he wanted to kill this guy, this character off for so long. He finally kills him off. And in an interview, somebody says, "This is amazing. All this, like, came from your mind." And he said, "Well, it didn't really come from my mind. It was this professor, Joseph Bell." And suddenly
Wow.
is thrust into the public spotlight. And just as Sherlock Holmes is killed off, Bell has to testify in one of this big murder trials in Scotland. And so he kind of
Wow.
steps on stage, and there's a ballistic expert named Dr. Watson. I can't even make it up. I mean, I looked at a letter that said, "My dear Watson," and I'm like, this is
This is
insane.
crazy.
So I just finished the manuscript for that, and Jack the Ripper features because Bell worked with his investigative partner on this, and he has his own theories on who Ripper could have been. But Liston, I believe, is dead by this time. But I
Or we
think the
think
reason,
so.
yeah, he was like 100 and something. I think that the reason, because Liston, if I recall, he dies actually quite young. I think he dies in his 40s. But I think the reason why you connect him is because there's a comic by, can't remember his name. He actually lives locally to us too. But he uses the Liston knife in the I think
Mhm.
the comic's called From Hell,
Yeah.
and it was turned into a movie, and they used the Liston knife that he created. And I think that's where you think, well, it could have been. But I mean, Jack the Ripper was messy. Would Liston have been that messy? I
Unless
don't
he
know.
was trying to be all like, throw you off the
Throw
scent.
everybody off.
But at least I'm a little settled because I thought it was Saeed. So at least now I don't think it's him.
I just feel like we're never gonna know, which is why
You
we're
have
so
to
upset.
solve it. If there's somebody who's
Yeah,
gonna
I
solve
mean
it, it's
that
me.
every year they come out with like, "Oh, we've done a DNA test." But the problem is, of course, the chain of custody. I mean, you could, even if you could extract the DNA, it's going to be corrupt on some level. It's going to be degraded, and you don't know who was touching this stuff in between. It gets, passed around. You don't know if the real origin is exactly what people are saying it
Yeah.
is. So it's really difficult. But I do deal a whole chapter with Ripper. But Bell works on so many cases. He works on a case for a baby farmer. Do you guys know what that is? You ever heard of
Mm-mm.
Baby farmer?
baby farmers in the 19th century? So they were people who would take, so a lot of women, because they didn't have contraceptives and they were very poor, they had many children they couldn't afford to feed. So they would farm them out to the baby farmer. And the idea was that the baby farmer would then find adoptive parents, and the baby farmer made money off of these exchanges, right? So they were placing these children with other parents and getting money. Sometimes the baby farmers just took the money from the parent, the biological parent, and they just killed the baby anyway.
Oh
And
my
Mm.
God.
so there's some famous baby farmers that come up for trial, and Bell's involved in one of those cases. So the Victorian times was crazy. I feel
It
like
is
you could
crazy.
easily get away
Yeah.
with back then.
It's
Yeah.
crazy to think about. It almost seems like we live in a very boring world these days, but
Yeah.
And
Well,
and
we
it's
can
also interesting.
channels, damn it. That's
It's also interesting because it wasn't that long ago, a
yes,
lot
I
of this
agree.
stuff as well. But tell me about your time at Oxford and studying to get your PhD. Obviously, you were fascinated by history, but what led you down medical history specifically? And did you ever wanna go to medical school, or was it always just.
Yeah, and I
well,
remember you and Joe Rogan talking about that you're not a real doctor, but
I'm
a
not a real
PhD
doctor.
PhD is a
Is a real
massive
doctor.
commitment. It's a massive
And
commitment.
people in the comments were like, Ross Keller would be so upset with you saying that you're not a real doctor. This is like the big argument because actually PhDs were like the original
Yeah.
doctors, or so to speak, and
Yeah.
it later gets adopted as a medical title. And in fact, fun aside, over here, surgeons revert back to Mr. or Ms.
Yeah.
Very confusing as an American living,
I
because
didn't
I
realize that.
and I had an appendectomy, emergency appendectomy years ago, and they were like, "Mr. Smith is," and I was like, "Mr. Smith, is this guy coming off the night shift?" Like I was like, "Is he a doctor? Like, what's happening?"
That's
And
funny.
no white coats either, which was also, they think
Interesting.
the white coat is unhygienic.
Did you have anesthesia for your appy?
I did. I did, thank God. But I mean, my local, we'll get into that story too. But my local hospital, we had to bring my father-in-law recently had a heart attack, and
Mm.
the elevator doors open, and it said 3-star hygiene rating. And I was like, like
Oof.
you would go
How
there,
many
you would go
stars?
to a restaurant like out of
Hopefully it was out of
5.
3.
Yeah.
It was not. So, it's sad because there's been a lot of funding cuts to the NHS here, so they're
Yeah.
they're really limping along, and that led on to my decisions, which we'll talk about later about my own care when I got sick, but
Yeah.
yeah, it's Mr. or Ms. And so and I always say to them, "But how do you know a Mr. from a Mr. Doctor?" Like, I
Yeah.
still don't know how you differentiate, but getting to Mr. is, like, the highest, like, accolade. Like, to revert back to Mr. means you're, like, at the top of the food chain medically again. So it's a weird system, so
Hank, you
and
can
Lister
call me
Yeah.
himself
Mister.
would have been Mr. Lister. Yeah.
So
Well, I think
what yeah.
doctorate is just the highest form of education or the highest degree you could get in any field, no matter what it is what I think a doctorate is. But then I guess it just got adopted for like a medical doctor or whatever. So I think some people say physician just, to
I think in Germany, you could
clar-
be like professor, doctor. Like you could have like
uh
like it. I mean, the Germans they love that. It's like
yeah.
like your doctor, professor. Like it's like a crazy. But but yeah, here it's. I mean, Lister would have been Mister Lister, and I talk
Wow.
about between art, of course, how surgeons really were at the low end of the pyramid because they were seen as people who worked with their hands. They had to make money using their hands. They were
Interesting.
essentially craftsmen rather than a physician who used his mind to heal people, and so it was a more cerebral activity. So the surgeons were really at very low on that pyramid, and then that all sort of changes with the birth of antisepsis and anesthesia, and suddenly surgeons can do a lot more to heal people rather than just cut off their limbs and kind of deal with the external aspects. And that's
Yeah.
also internal medicine, so the physician dealt with the inside, and then external was the stuff that the surgeon dealt with, like anything kind of that had to be chopped off, I guess, was the purview of the surgeon.
It's so funny because we talk about you having a PhD, but I feel like you're teaching the world so much about medicine that like so many practicing physicians don't even know. But so
Yeah.
what made you pursue a PhD?
Well, I was at a very small university called Illinois Wesleyan for my undergrad, and I went to Oxford as a junior year abroad. And I had taken a course on intellectual history, and I had read a fantastic book called Galileo's Daughter by Davis Sobel. It's old now, but it's still a great book. It's this correspondence between Galileo and his daughter who was in a convent, and you get this amazing dialogue between these two historical figures. And so when I got to Oxford, I said, well, maybe I'll study, the history of science. And they panicked. They didn't My coordinator didn't know what to do. Like, that is that a subject? And so they went to the head of the department, a man named Professor Robert Fox, and he said, I'll take her on for a year. And so I had one-on-one tutorials with this man
So
for an
cool.
entire year. We
Wow.
Whole expanse of the history of science. He's really, I mean, Oxford's like a very strange, weird place. You wear robes to dinner, and it's very kind of Harry Potter-esque. And it's how it works is you have a primary tutorial each week for 8 weeks, and then you have a secondary, which is every other week. And your tutor will give you like a list of 35 books and tell you to go read them and write an essay. And they usually give you like some kind of prompt as well, your essay. And then you come back the next week and sometimes you read it to them and then you discuss or you argue or they challenge your ideas. And so it's a really strange way. It's very like you're almost self taught, but it's incredible because you get this opportunity to have these intimate conversations with some of the brightest people in your field. And so I fell in love with it. And then when I came back, I ended up moving more into history of medicine. I mean, it's my degree is technically history of science, medicine, and technology, but I moved more in a medical direction. And I did my PhD on the history of alchemical medicine in the 17th century.
Wow.
And I have no practical skills from that, except I learned a lot of obscure knowledge and I learned how to argue but it was fascinating. And for me, really the decision to do the PhD was I just loved Oxford. It was this magical place. I thought, how can I
It is a magical place.
it up, like I just want to spend time here. And I tell students now, you don't know how lucky you are because in 20 years you'll look back and oh, this was a magical time. You don't have really any responsibilities. You think that you're stressed, but you have some exams and it's not a big deal. And it's just a wonderful time. And Oxford really encourages you to follow your curiosity. So you really as you go through your degrees, by the time you get to the PhD, you really get to just kind of choose your topic and go have discussions with, who's going to help you with that, go into these amazing libraries and touch history and read history. And so it was wonderful. So I kind of just went into it because I just wanted to spend some time at Oxford. And then, my dad was like, you need to get a real job at some, like, what do you do? historian.
It'd be cool to see you in, like, old pictures from those times, like, in a white robe at dinner and
Oh,
things.
yeah,
Do
I
you have
got
any?
him, I got him,
That's
yeah,
so
yeah, I wa
cool.
I well, and I was like it's funny because my old department asked me to come speak recently, and I joke that I'm like the P.T. Barnum now of medical history. I'm like, "Roll up," I got a lot of makeup and I'm weird and all this kind of stuff, and I think they're like, "That's not what we gave you that PhD for," but they delight in sort of the weirdness, and when I went to speak, I was like, "I just have to embrace it. I just have to go full Lindsey Fitzharris for this," and it was fun, and the thing that they are surprised about is that people outside of the discipline want to read medical history. And I said,
Yeah,
there's so many people. It's not just doctors, it's not just medical professionals. People love medical history because
Of course.
everybody knows what it's like to be sick,
you're so
and it's
right.
very relatable. So,
You're so right. Everyone knows what it's like to be sick. Everyone knows what it's like to be vulnerable. The patient physician trust that is necessary and like just the whole backstory behind it.
yeah.
Like every single person is interested in medicine. You really nailed it.
Yeah.
They don't think about it actively until I say something like, have you ever thought about what it would be like to have a toothache in 1835?
My gosh.
Or you have to have an amputation,
That might
and
be a
it's,
death sentence.
yeah, very well. Teeth, I always think of teeth in the past because there was really very little that could be done. It's, you think we're going to get to this, but I was diagnosed with breast cancer in 2022, just after the Facemaker came out. And I went public with my diagnosis, and people now come to me when they get diagnosed. And I always tell them that today is the best day to be diagnosed with cancer, and tomorrow will be even better because we are constantly improving. I mean, and I don't have to tell you guys, if you look at even in just the last year, the kinds of advances we make in cancer care is extraordinary. So I never would want to go to the past. Like I feel like I would have died, at like 5 or something. As something dumb would have happened. I was a sick child. I would
Which
whooping
I
cough. Or,
feel like is interesting nuance with you is because I feel like a lot of medical historians or people who love history are very nostalgic about the past and they almost wish they could live in another time. It always makes me think of the movie like Midnight in Paris. Yeah, where it's about, old Paris and they go through each of the different times. It's interesting how you are fascinated by the past but still appreciate, the present and how far we've come.
please, I literally build my social media on if you feel bad about living in 2025, come see me. I will tell you
Yeah,
why you
yeah.
should not feel bad
Yeah.
about that. I mean, the nostalgia is a dangerous thing too because it's easy to simplify the past. I'm a woman, so would I really have wanted to live,
Yeah, good
pre
point.
1920? So it depends the perspective
Yeah.
you're coming from there. But life was cheap, and you could die quite easily from things like the ruler to the gums. You could die quite easily. And you think about how much we can now do for patients. It's extraordinary.
To think about too
And
what will
now
come in the future.
yeah, and now really the big ethical debates in medicine is how much is too much intervention, right?
Yes, you're
And so
right.
we can really do so much now that it's almost sometimes ethically too much. And
Yeah,
those are the debates that we're having. But it wasn't that long ago that of course we couldn't do enough. I mean, people would just die. And
such a great point.
yeah, so and also I love talking to doctors because really the time that's passed between your training and some of the doctors that I write about isn't that much. Sometimes it's only one generation in between. I've met plastic
Yeah.
surgeons who say they were trained by the guy that was trained by Gillies, and
Yeah.
it's oh my gosh, so that guy would have been very young, Gillies would have been very old. And so it's amazing how, in a very short period of time we've come very, very far.
Yeah.
Yeah.
No, what I was thinking, just talking about all this with nostalgia and everything is like I just went to Disney World with the kids and my wife and I love walking in and seeing how magical it is and just like
Yeah.
living it all. And I thought to myself after, preparing for this and talking to you, like how great would it be if there was a place like Disney World where you could like walk into the 1860s for like one scene where everything's from the 1860s. People are
Yeah.
dressed like it. Then the next scene is like the early 1900s,
Yeah.
whatever. I think that
It
that'd
would
be we gotta create that.
Well,
Yeah.
at the Museum of Science and Industry in Chicago, they have something called Olden Time Street or something. And when I was a kid, this is how I knew I was gonna, looking back, I was gonna go into history because I was more interested in going down Olden Time Street and walking into the past than I was about all the future technologies. You say walking into 1860s, immediately I start thinking of smallpox,
Yeah.
all of the kind of terrible things that we were sort of battling. By 1860, we have a vaccine for smallpox, but it's not as effective. People are still catching smallpox. That is one disease that, we truly would never want to see
Yeah.
return. So I love the past. I'd love to go in, but if I was like a bubble boy, like I had a bubble around
Yes.
me and I couldn't catch anything weird, or I could bring antibiotics with me, like I would want to come well armed going into 1860.
What brought you into our world of plastic surgery, and we're so honored that you have taken on this scholarly pursuit. We've all learned so much from you, and we've been dying to have you on.
Thank
And our paths first crossed in Chicago at the American Association of
Okay.
Plastic Surgery when you came, and I actually got one of your books that day, The Facemaker, and you actually signed it to me as well, which is pretty cool.
I that went really long, and I remember like I was sweating profusely at one point. It's like,
Yeah.
wow, a lot of people, but it was
But
good.
it was just yeah, it was so fascinating, and I'm sure a lot of our listeners who have a background in plastic surgery know who Harold Gillies is, but we also have a lot of other listeners and people who've heard his name but don't know that much about him. Tell us a little bit about the Facemaker, who he was, and bring us into that time a little bit.
Yeah, so the Facemaker, my publisher jokes too that right before it came out, a friend at the publishing house said the book that you never wanted to write is about to come out. Now that isn't quite accurate, but what had happened was I pitched an entirely different book after the butchering art that the publisher wasn't convinced that anybody would read, I guess. And so I pivoted and I said, well, there's this guy named Harold Gillies, and he was, yes, that's the book we want. And I instantly regretted it only because I'd always intended to write about it, but I knew very little when I started out. I mean, I didn't even really have a full grasp of why we entered the First World War. And if you listening don't know, it's all for stupid reasons. So, I mean, I'm not even
I believe it.
so, I had to, it was like doing a PhD where I had to really immerse myself in World War One history and World War One military medicine. I mean, just so much stuff to learn and then kind of condense it into a fascinating story that an average reader with no medical background, because that's always what I try to write, could pick up and enjoy. I didn't know much about Gillies. I certainly didn't know much about facial reconstruction, but the one thing I knew was that I wanted to drop the reader right into the middle of the action from the first page. And
Mhm.
I was lucky enough to find the diary of a man named Percy Clare, who is wounded in the face. And he writes this diary beautifully about this. And this is unusual because a lot of the men who received facial wounds in the First World War didn't talk about their experiences. It was very taboo. I often say that this was a time when losing a limb made you a hero, but losing a face made you a monster. And so Harold Gillies is kind of thrust into the theater of war. He's an ENT surgeon. There is really no such thing as plastic surgery as such. There's people are doing it a little bit in earlier centuries, but on a very small scale. And suddenly he's faced with this tremendous challenge to rebuild these faces. And some of the damage to these faces was extra. I mean, I would look at these photos and think, I don't know how anybody could survive an injury
I
like
know.
that.
Yeah.
Yeah, and that was really a friend of mine who's a doctor said, "Well, the really kind of disturbing thing is that you can pretty much lose all the soft bits of your face as long as the brain is protected, like the body will continue on some level." So some of these men were certainly facing, extreme disfigurement and in walks Gillies and he becomes this perfect vessel for this challenge because he's quite funny the way he looks at life. He's got this big personality, and whereas a lot of doctors and nurses at this time, they couldn't even look at these men because it can be very challenging to look at somebody with a facial wound like that. He was able to look past this almost immediately and he really saw the humanity in them and he built these extraordinary relationships with his patients at a time when most surgeons in the First World War, they were really just dealing with a patient for a very short period of time, stop hemorrhaging near the battle line, whatever. They were not working on these people for years at a time. So that was a really wonderful part of the Facemaker, was that kind of relationship between doctor and patient that sprung from Gilly's story. But it was challenging. I mean, the other thing was that his notes, he talks about his reconstructive process as if he's making a piece of toast, in the sense he expects who's ever reading it to have a base level of knowledge that I didn't necessarily have. And so oftentimes I would have to have my husband, who is not a doctor, he's a caricaturist, but he knows people anatomy very well. And he's not like the carnival guy. He's been doing this since a kid. He worked on a famous TV show over here called Spinning Image, and he could really, capture caricature. And so he would draw what Gillies was doing. And he was fascinated with this story
So
too, because
cool.
he worked with an artist named Henry Tonks who had trained as a caricaturist as well.
Mhm.
And so faces are fascinating, and what happens to us when, that's gone. What happens to our identity. And so, but it was a scary book to write because I knew virtually nothing. I never ventured into the 20th century. There were things I had to prove that these guys were dead to get access to their patient records.
Yeah.
So it was challenging to say the least.
And I remember one of the things that you've said before was you were wrestling with the idea of whether to put the pictures of these patients in the book or not.
Oh my gosh, yeah. That was so my editor, I shouldn't probably say this about it, but he was like, "Oh, these are too graphic. We can't put these in." And I said, "Look, we have to put these photos in because when Gillies opened his hospital, there were blue benches around the hospital, and the men would sit on these blue benches so that the public knew not to look at them. This was a really isolating injury." And I said, if we don't put the photos in, I'll be putting them on the blue benches. And we have to have a reckoning. We have to look at these men. And we also have to acknowledge that a lot of what plastic surgeons do now owes a lot to these men themselves, not just Gillies, but the
100%.
operations. And there's a guy named Private Ashworth who I talk about. He's one of my favorite patients. He lays on the battlefield for 3 days. He's unable to scream for help. He's got no jaw. And he finally makes it to Gillies. His fiance breaks up with him. Fiance's friend ends up falling in love with him. And later, he goes back to work as a tailor's assistant, and his boss tells him to work at the back of the shop because he would frighten the customers. And so he eventually just leaves Britain. He just
Yeah.
starts over in Australia. And many years later, he bumps into Harold Gillies, and Gillies is grown as a reconstructive surgeon. And he asks if he can have another go at his face, as surgeons are wont to do. And Ashworth declined. And we don't really know why he declined. But, you have to think that some of it had to do with the fact that it was painful to go through these surgeries. And also, Ashworth had made peace with his face. His niece said that he had made peace with his face, and it had brought him a lot of happiness, even though it was an imperfect face. And I think that, again, there's something about identity at the core of what plastic surgeons and reconstructive surgeons do. And the joy of this book has been meeting plastic surgeons who say, thank you for reminding people that we do things not just cosmetic, although cosmetic is certainly an important part of plastic surgery, and Gillies moved into
Yeah.
cosmetic health. But there is really important reconstructive surgery that still goes on to this day, that literally changes patients' lives.
Yeah. I mean, our podcast is titled The Deep End, which is a technique for breast reconstruction.
Right. I
Yeah.
was wondering, I was like, is DIE? I was like, what is this? I didn't.
Yeah.
Yeah.
Well, we should do a collab, dead ends versus deep ends.
Yeah, yeah. No, and it's everything that you're saying, there's a couple of important points. Like, first off, like how you stuck to your guns with this idea and push forward what you thought, what you envisioned the book to be with the patient photos, et cetera. And then look, it comes out, New York Times, LA Times bestselling book. So, yeah,
Sorry, I film like I can't believe a book about one facial reconstruction. I mean, was really proud that because World War One's not something a lot of Americans really care about,
of
and
course.
reconstruction seems like an odd. But I think the way that the write ups were about the book, it was really focusing on the patients and their incredible stories, and I think that's what connected with readers in the end.
Well, it's just a testament to like your incredible, incredible talent. I mean, and just like how brave you are because it's one of those things where like it releases, it's a New York Times, LA Times bestselling book, or it releases and no one reads it. So like
You
you
for
just
reminding me of that as I head into another book launch.
no,
Yeah.
but it also brings up an interesting topic, Hank, because I always think to myself, like, how many people are in this world? Like, how many people are in this world, but no two faces are the same, which is crazy.
Now but the caricaturist I live with is always telling me faces repeat, and he
Oh,
convinced all the time. Like he'll show me
Wow.
it's he once he does it, I'm like, oh my gosh, it's the same face. It's
that's
very
You kind of
wild.
look like Jack the Ripper.
Yeah, exactly. And
Yeah.
so then Hank and I had, and this talks about a little bit about like how you said going back in past, but we had Dr. Eduardo Rodriguez as one of our guests who did he did many face transplants actually for these sorts of patients now. And he did the world's first face and double hand transplant. And so you mentioned like, taking a step back in time and how far we've come. And now we're doing face transplants, but a lot of this stems from the early work that Gillies did. And it's thanks to
Yeah.
him and thanks to your book that like it really brings it to light and talks about like, you even mentioned, you know, these people could die and then but then they live with this disfigurement that almost is killing them deeply, and so that's why I love reconstructive surgery. It's like people automatically think plastic surgery is like, cosmetic, et cetera, and there is a lot of aesthetics to it, but it's also bringing back the meaning in life,
Yes,
you
absolutely.
know?
To go into the breast cancer, this was really important because when I was diagnosed, I mean, it came out of left field. I guess we can kind of segue into this because we were going
Yeah.
Yeah.
to shortly after the book came out. I was in LA and a friend of mine had a glioblastoma, and I knew this was the
Ah,
last time. I
Mm.
know. I say that to doctors. That's exactly. I mean,
it's like
you're not.
pancreatic cancer.
Yeah, exactly. You're not gonna come out of it. And so I went to see him and he started asking me a lot of questions about my family history and like he just said, well, he was a magician and actually this Houdini box back here is one I kept it. He came onto set when I was doing the TV show and did some magic for the crew. And he was just a brilliant guy. His name was Tom Peterson. And Tom asked me all these questions, and it just kind of put cancer in my mind. I was 39, about to turn 40. I didn't think I was, I mean, this is the crazy thing. You don't think you're old. You never think you're old enough. I think you
You
could be
never.
like, I'm not old enough for, you
Yeah.
I just it wasn't really on my radar, but then when people start dying who are around your age, you start thinking about it more. And I came back and I remember I felt something and I thought, "Oh god, I have so much to do with this tour." But, Tom told me don't ever wait. So I went to my GP. My GP felt it and he was like, "It's nothing." And by the way, important background, women are not offered mammograms in the UK until they're 50. So there's not
Wow.
Wow.
So what do you do
yeah.
if you need it earlier?
Well, if you feel something, you can
Okay,
get one, but they're
gotcha.
not
It's
doing
not routine.
yes. I hadn't been called up. I just turned 40. And so my GP was like, it's nothing, it's a cyst. But I said, but you know what? Let's get the referral. And so I went to my local hospital. I went in for the mammogram. They kept calling me back for more. And I was like, what's happening? And they're like, boobs are weird. And I was like, I guess they are weird. So they would try to keep it light. And then eventually they brought me to the radiologist and she has my mammogram up. And the first thing she asked me is, are you a doctor? And I start for all these silly stories and so she determined like, oh, you don't know anything, so
Yeah.
okay, well, I'm telling these weird stories about medical history. And she's kind of talking about my mammogram and I said, are you telling me I have breast cancer? And she didn't say yes or no, she just nodded. And I said, oh my god, could it be this or that? And she said, she just shook her head and she said, we got to do a biopsy. It looks early and all those kinds of things. And thankfully my husband was with me in the back. And so I texted him and I said, they told me I have breast cancer. Eventually they ushered me into the surgeon. And of course, surgeons don't want to ever definitively say anything. So my husband said, does she have breast cancer? He goes, oh, we don't know.
Yeah.
Mhm.
And so when we walked out of the hospital, I said, I have breast cancer because that radiologist, I don't think she was so sure. Like it wasn't like
Mhm.
she was like, this is cancer. So from that point, and by the way, the thing I felt was nothing. They found a totally incidental cancer
Wow.
deep in the
Yeah.
breast. So if I wouldn't have been offered mammograms, I mean, the outcome of this could have been very different for me. So I kind of chugged along on the NHS for a bit, and then I decided to go public because I write about other people's experiences with illness, and I felt that I wanted to share my experience.
Mhm.
I did Wall Street Journal, and I was on Twitter, and this surgeon reaches out to me. His name's Paul Farachelvam at the King Edward VII Hospital in London, and he said, "Well, if you ever have any questions, I just read The Facemaker. I'm a big fan, and if you have any questions, feel free to bounce them off of me." And so I started thinking like maybe I need a second opinion.
Yeah.
I was 48 hours away from having surgery at my local NHS hospital. They were going to go through the top of the breast. It was going to be like they said a third operation. I mean, I know any I wasn't think I was just like, "Just get the cancer out." And I go to see Paul, and I get to this hospital in London, and he spends an hour just explaining everything that had never been explained to this point. And then he starts drawing all over me, which again, the surgeon who was about to operate on me, he hadn't even ever physically inspected me, which now in retrospect, I'm like, wow, that's crazy. But it wasn't something I just assumed everything was in hand.
Yeah.
And he's drawing all over me. And then my husband says, "Oh, it's like what I do." And Urchin goes, "Oh, I'm sorry. Are you a doctor?" And I was like, "No, no, I don't know what he's talking about. He's a professional man. This is not what he does." But he's, "Oh, it's all about bringing things in proportion." I was like, "Okay, please."
Yeah.
But I remember at one point he told me to look down. He said, "Well, that's going to be like the size." And I was like, "Oh, it's going to be a bit smaller than the other." And he goes, "No, I'm going to do the other one as well." And it was like this whole thing I hadn't considered, which is you have to live in your body after cancer. And it
100%.
and it was great that he was thinking about that. Interestingly, at the AAPS, I was always asking plastic surgeons about this because in America, the plastic surgeon is separate from the oncologist surgeon. He
Mhm.
does everything. So that's a very European way of doing it. And he has his own views. Like he thinks it's crazy that there's like a plastic surgeon come in. But then I was told at AAPS, you don't want your cancer surgeon necessarily thinking about the reconstruction. You want them focused. So I can see like pros and cons
Yes.
of both of those systems.
Yeah. You know,
Yeah.
the way we're kind of talking about things in the States is you are having more of a sort of blend across specialties. So I wouldn't put it past breast surgeons here at some point doing some of their reconstructions. You bring up so many important points that are like just so sort of special about medicine and particularly the patient physician interaction. For instance, we as physicians will see patients all day long. Every patient's individual story is incredibly important for that patient. And we all have to take a step back. And despite seeing 40 patients in clinic, each patient's story is incredibly important. It has a true impact on the rest of their life. And I think one of the ways that I like to practice as a plastic surgeon is I always tell the patients is that my goal is that after surgery, I don't want you to remember through scars or shape or whatever that you just went through cancer. And so my goal is to make you at least back to normal, or if not, even a better version of normal. But I don't want you to look down and say, okay, this is reminds me of cancer or whatever. And through all of your experience, what do you think matters in a caring provider in your journey? Because it seems like it's sort of a unique journey about how you came across your ultimate provider. But what do you think what do you think you found that was most impactful for you?
Well, I joke that I am now Paul's agent. So I go on radio and I talk. But
You're like the
interestingly,
best. That's awesome.
Yeah.
out there, plugging him. But Paul, he works in London. He works at the King Edward VII, which is the hospital where the royal family's treated. It's a fantastic place. But he also works in an NHS hospital. And he said it's a fight every day to give his NHS patients the same level of care that he gives them. So it is really a postcode lottery. If I lived in London, which I live in the rural sticks, I think I would worry less about going to an NHS hospital because it's better funded. You have the research doctors there, like you have state of the art
Mhm.
care. I just have this kind of local rural hospital, not maybe the best kind of care. The biggest decision really for me was when Paul told me that, or no, sorry, the NHS hospital told me that after surgery, I would be mammogram once a year until I turned 45, and then they would stop until I was 50. And
Mhm.
Paul was like, "Nope, you need a mammogram every year. You need an ultrasound twice a year, and I would ideally like to do a breast MRI every other year. You've had breast cancer. Like we need to monitor this." And so that aftercare, the thing that surprised me most about my journey was that the aftercare is actually just as, if not more important. And you really have to consider what that aftercare is going to be because you want to be monitored. You want to have the
Yeah.
best, chance. I mean, to some extent, though, the other thing that's surprising is they love to poke and prod you because anything that comes up, it's like, oh, you've had cancer. Like we're
Of
gonna
course.
this and we're gonna do that, and so that can create some anxiety. But on the other hand, I don't have a lot of medical anxiety because I'm a medical historian. I'm trust medicine, but I can see how for some patients that could be really scary. But when you were talking about, you know wanting to having reminders of the cancer. When I came out of this 8-hour surgery, because he decided he wanted to do both sides, he was going to bring another surgeon in. So it was like a really long surgery. I came out and I remember I woke up and he came in and he like opened up the top to like check the bandages. And I was like, it all looks fine. And he's like, yeah, what did you think it was gonna? I was like Frankenstein boobs. I don't
I
know. Like I
know.
to be like a bloody mess. Like it looked, I mean, actually the really startling thing for me was I had a lumpectomy and then reduction
Yep,
because at that
that's what I
point
gathered.
he sent me a lot of journal articles because I'm a nerd and he was like, at this point, we don't know why, but for my early stage cancer, it seems like lumpectomy was better. It comes with radiation and that's
Mhm.
that. But so I did that, but oh, now I lost my train of thought, but I thought it was gonna be a horrible mess, and
Yeah.
it that was the oh, yeah, and so it looked so good. I was so confused as why it hurt.
Yes.
Like, well, done a lot under there. It looks great on the outside, but, like, because I was like, "I must be the biggest baby. It doesn't even look bruised. What is happening?" And so that part was really funny because you do look kinda normal, and you just think, "Oh, I could just, I'm operating normally," but you definitely aren't. There's, like, a long recovery with that, so
Yeah. So, what I wanted to talk about, since we're talking about your journey through breast cancer, is we kind of have this your own story, in an unfortunate way, but we have someone who, by coincidence, delve into the pioneer and the genesis of plastic surgery, knows all about that, and then you cross path on a personal level when you're struck by breast cancer, which is sad and awful. But I'm curious, going through what you've had to go through in terms of studying and for your book writing, how does that change your journey as a patient in plastic surgery, knowing everything that you've known? Would you have written the book differently, or how does that make you think differently about Harold Gillies now going through it after you've already written?
these are great questions. I think also, like, my being a medical historian was more an issue for my doctors because I would, like, walk in and I tell everybody these horrible stories. Like, they were doing a biopsy through the mammogram at one point, and I was talking about Lucy Thurston, who's in The Butchering Art, and she has a mastectomy without any anesthetic, and the doctor walks in and he shows her the knife. He doesn't even tell her the day he's gonna show up. He shows her and he tells her to prepare her soul for death. Like, this is a
Oh my gosh.
have to tell a patient. So I was always kind of telling because I'm a ridiculous person and people were like, "Ooh, pipe down," people are around, like patients are around, like let's not get people nervous. But I was always like in there kind of delighting, hopefully delighting people with these weird stories. And for me, again, it was always like, look how lucky I am. Like I don't have to have my breast cut off without all of these things. And also, Britain, I have to say one of the really bad things about living in Britain is there's a total lack of preventative care. Like we don't do preventative colonoscopies, screenings, or anything. Like it's not great. And my husband's British and he's very British in this sense. And so when he turned 50, I was like, you haven't seen a doctor for like 10 years. You need to go see a doctor. I'm fine. And I said, go get some please go get some blood tests. I've been asking for years. He had prostate cancer and he
Mm.
caught
Oh
it
my gosh.
and so it happened that he also had private insurance because I had also orchestrated that because I was so American about it. So I told my breast surgeon, and he said, I know the guy who should do this. And like literally, people fly from out of the country to come and get surgery with him. And he'd actually just operated on the king. And I was like, okay, that's definitely the
Wow.
and
Mhm.
and he's come fine, but he's really, a lesson in you can feel fine and not be fine. And so, as patients, we have to be proactive about our care. And it
Absolutely.
struck me when I was going through that it would be a really good thing. I mean, maybe you have something like this in America, but like a charity foundation where if you get diagnosed, you could be assigned like a partner who is medically literate, who could sit in these sessions and ask, because sometimes you just don't even know what to ask.
Yeah.
I was first diagnosed, I was just so shocked. When I told they were going to go through the top of the breast, he goes, well, you just wrote the facemaker. What would happen? And I was like, oh, right.
Yeah.
Sorted over time, and he said, yeah, exactly. He's like, you want to, and then he explained. So for me, the best part about finding my surgeon was that I could relax. I knew that he had it covered, but I think a lot of patients, they aren't medically literate and they don't know what questions to ask. So therefore they don't know what's being missed. And so that always struck me as like somebody should start a charity where, you could just say, I need somebody to sit in on these consultations and help ask these questions. And But how would I change the face? I don't think I would have changed the facemaker. People always ask me, would I write about the history of breast cancer? I don't know. I mean, again, that Halstead, his story's been told so brilliantly. And he invented the radical mastectomy. Interestingly, Halstead really did not care about the aesthetics or even whether the patient could be mobile. He just wanted to get the cancer out. So he really left a lot of these women severely disfigured and disabled from these extreme surgeries. And it was only kind of recently, I'm saying recently as a historian, that we took a step back and we found balance in how much tissue we have to take. The Oncotype test is brilliant because, 30 years ago, I'm making up a number here, but like every breast cancer patient would have to have chemo. I didn't have to have chemo. My Oncotype score was low.
Oh, that's so
Again,
great.
when people and in aid, he had a prostatectomy. We went through a whole process with him where like, what do you do? Well, if you're 50, you're still kind of young. And so I just remember there were other options given to him. And then we went and saw the surgeon for the last consultation, and we were kind of moving towards a less aggressive, it's called HIFU. It's like a high ultrasound treatment. And one of the doctors at the hospital is one of the lead doctors who does this and said, a great candidate for it. And I said to his surgeon, I said, well, if he does HIFU and the cancer comes back, how hard does that make the surgery more complicated later? And he said, yeah, it can. And he said, and also it's when it comes back because he's 50 and the odds are it will come back. So we decided, look, let's trust the surgeon. So he had the surgery. And when they took the prostate out, they found out that it had more cancer on it than had come up on the MRI. So the HIFU,
Wow.
and he would have been a worse surgical position at that point. As it was, he got 100% nerve preservation. So it was an optimal surgery. And I just, for my breast surgeon, I'd asked him, like, what do you think we should do? I asked my breast surgeon, what should we do about the prostate? But he knew this surgeon. He goes, he's a good surgeon. Trust your surgeon. You can look at data
So
and
true.
odds, but if your surgeon's like at the top of their game, those odds are going to be, even better. And we have no regrets. And it just,
Yeah.
and actually, for context, another thing that happened right when we were making the decision was an Olympian named Chris Hoy. He's a cyclist in Britain. He's won like 6 gold medals. He's 48. He came out in the news. He has terminal prostate cancer. And I
Mm,
was like, oh my God. Like, I just looked at Adrian and I was like, get it out. Like, I don't want to, we
yeah.
don't want to out this later on. So it's very personal though. Everybody has to make those choices, but finding the right doctor is for whatever reason, whether they're at the cutting edge of a technology or they're very personable and they're going to give you that kind of experience that you need because you're vulnerable. Those are all really important factors when making those decisions.
Yeah. I think you brought up so many important points that are just you have to just reiterate over and over to people. And I think, Hank and I have talked about this before too. Like in a world of I'm talking about on the medicine side and plastic surgery side is so filled with social media and everyone kind of self-promoting themselves as the experts in the field that to take it back to what you said, I think the number one thing that patients should go by is based off of strong recommendations from people that they trust. Take it a step back, put social media aside and, a strong recommendation from somebody you trust, because this is a life-changing moment for you. And the other important thing that you mentioned that is so incredibly important is that oftentimes between the different surgeons, like in the US, we have the breast surgeon involved and the plastic surgeon involved in these cases, like your case. And we have completely opposing goals. The breast
Yes.
surgeon wants to remove the cancer. They don't care about how much tissue they remove. Well, that's not true. Some of them do, some of them don't. But they want to remove the cancer. And the plastic surgeon wants the patient to look as good as possible. And finding a happy medium so that the patient isn't left disfigured is so incredibly important. And then the last thing I'll just want to hear from you is that, especially with all your writing and the medical history about surgeons now are being trained cutting edge techniques, yet empathy and presence are completely timeless. And so, what do you think you wish clinicians or surgeons understood better about kind of like the emotional, psychological dimensions of cancer care?
I mean, to some extent, you don't want your surgeon to be, too emotionally involved. That's not good either. You don't want them thinking about like she's got 3 kids or whatever it is, because that adds a lot of stress. And I've interviewed surgeons about,
You're
how do
right.
you find, but having that humanity is important. And all of the doctors I've written about in the past, that's what really makes them stand out. Joseph Lister, he would not even charge his poor patients. And Harold Gillies certainly his humanity shined through in the way that he treated these disfigured patients. And I always say that ironically, Harold Gillies sort of gave birth to modern plastic surgery, and he did it to help these disfigured soldiers. But as a result, we're all a little bit more hyper aware of how we look, which is kind of an ironic twist to what is the outcome of what he does. And we do have to be worried about, how we present ourselves on social media. As, I think of a lot of plastic surgeons who promote their work. This is great, but we have to remember that kids have access to social media, and there's a lot of pressure on people to look a certain way. And so I do worry about, finding that balance of reaching your patients and showcasing your work, but also making sure it's not doing any kind of unintentional harm, because we are all a little bit obsessed with how we look now. And there's a lot of pressure on women.
Yeah.
And I think probably it's still accurate to say that most patients for cosmetic procedures are women still, whereas the surgeons are tend to be more skewed male, which is an interesting dynamic that you have men operating on women and kind of defining in their own eyes what, a female body is supposed to look like. And I always tell, younger children, not children, but like young teenagers that look, in the these really thin eyebrows were in, and now they're like, that's like a horrible thing.
Yeah. Oh,
You
that's good for me.
right?
Yeah, I'm just kidding.
There's no universal beauty standard. And so when you're altering your body, you have to think about this, like
Yeah.
maybe something that looks good, but maybe in 10 or 15
You're
years that
right.
the fact you do have to kind of consider that. And I think just the immense pressure, but yeah, you have to I've developed weird relationships with my doctors because I'm a weird person, and I foist my books on them, and I talk about medical history and they enjoy that. But yeah, you're right. You do have to kind of find that patient's story. I think it's important that a patient feels listened to. And certainly there's another story I'll share real quick. Lister, and I tell this in the butchering art, where this little girl has a doll and her doll is wounded and he sews the leg back on. And it's just this really gentle moment where he's really kind of paying attention to what this girl is wounded herself.
Yeah.
And I just love that moment with Lister. And I think those kind of tender moments, those are the things that I love about these doctors. And if
Yeah.
you guys read Sleuth Hound, Joseph Bell also is just this fascinating character. And what was interesting to me about telling his story was that he is like Sherlock Holmes in the sense that patients would be brought in and he could tell you everything about them you know, from the mud on their boots to, I mean, just these extraordinary insights. But he got really annoyed by being compared to Sherlock Holmes, who was really quite this sociopathic, unfeeling character. And Bell himself was much more dynamic. And he kind of gets reduced to this caricature of Sherlock Holmes. And so, what I hope I've achieved with Sleuthhound is that I brought a more well rounded view of Bell and restored his actual legacy. There is this Sherlockian thing that he does. And certainly, the character of Sherlock is based off him and it lives on forever because of Bell, but he was a lot more than just that character. And we have to remember that about our doctors too, right? You know,
Yeah.
You're right.
there's a great show called The Nip. You probably saw that, right? Um,
Yeah.
Clive Owen, and not to spoil it for people, but in the first episode, there's this right at the beginning, there's this big operation, it's turn of the century, the Knickerbocker Hospital in New York, and the patient dies, and the surgeon kills himself. And it reminds you that as crazy as the past was, it would have been really frustrating to go into that operating theater and keep losing patient after patient. These men in the butchering art, they are in the business of saving lives, and they can't save lives. They don't understand why these patients are dying. And so I do try to remind people, as funny as like Liston is with his 6'2" and his the knives, maybe he's Jack the all these kinds of things. I can't imagine how frustrating it would be to be a surgeon in that era, or frustrating for Harold Gillies to operate on these men to restore their faces, to send them back to the front for them to be shot and killed.
Yeah.
There's challenges for doctors as well, and
Yeah.
doctors are not gods. That's a really important thing I think patients have to accept and take ownership of their health a bit too. I think there's a lot of like, I'm going to go to the doctor, he's going to fix everything, he or she's going to fix everything. We have to keep up with it. My husband's got to go in for his yearly checks. That's the
Yeah.
otherwise you get to where things have progressed quite far, and it's a lot more challenging.
Yeah. We So we spoke about Joseph Lister a lot throughout the beginning of this episode to the end. And just for we know who he is, but for our listeners who don't know, they probably know from Listerine mouthwash. But can you just give us a few lines for the people who don't know why we've spoken about Joseph Lister so much,
Yeah.
other than your book, obviously?
I just like it's like he's like a friend. Like I just figure everybody sort of knows him.
Yeah.
Right, people will recognize his name through Listerine. He didn't invent Listerine. It was named for him, but not by him. Lister was the man who solved the mystery of what was killing the patients, which was germs. So he takes Louis Pasteur's germ theory. Louis Pasteur is at the time is working on this very French problem, which is why is wine spoiling? And he's worried about the wine spoiling and it smells kind of funny and he realizes that it's this bacteria and so Mister's reading this and he's thinking wounds smell sour
Mhm.
rotten as well. I wonder if the thing that's making the wine rot is making the wounds rot and so he develops antisepsis and he's not believed really at the beginning. And I think this is a really important point, which is that, as doctors, you have to be open to new solutions. What we know today is not going to tomorrow. Oftentimes, it takes somebody, from the outside. Lister isn't, initially respected or believed. And in fact, if anybody's watching the Netflix series Left by Lightning about President Garfield's assassination, you'll notice that Garfield was shot and the bullet went in, it did not come out. And his surgeons did not believe Lister in antisepsis. They were digging their dirty fingers and instruments in. And that's what killed him. He became septic. And in
Mhm.
at the trial of Charles Guiteau, his assassin, he says, I didn't kill Garfield, the doctors killed him, which was probably true.
Yeah.
If they
I
had
mean,
let it in, he would have been fine.
wow. It's so interesting. And it also is it's why I love science and medicine. It's like one of the only fields where you're like rewarded for proving yourself wrong or furthering yourself and you're publishing on rather than just standing on, what you believe. It's we're constantly trying to move forward and you're praised for, what, I thought this way for 10 years, but actually it's better. We figured out it's actually better to do it this way. So I think that's what I love about it.
And people ask me, like, why wouldn't people believe in germs? But you have to remember that, first of all, doctors didn't wash their hands because they were just going to get dirty with the next patient. Like, it just seemed like a stupid thing to do. They didn't understand germs. But also, the microscope wasn't really used in medicine at the time. And Lister used the microscope for reasons I go into in the book because he's a Quaker and he's not allowed to do like dancing and singing as pastimes to like the science direction. And so his father taught him how to use the microscope. And it's kind of like his lightsaber, right? It's like the
Mhm.
moment he's like given this powerful tool that's going to solve this thing for him. But because doctors weren't necessarily scientifically literate in that sense with microbes and stuff, they just it was hard for them to believe that there are these invisible little creatures and they're killing your patients and
Yep.
me, I can see them with this instrument called a microscope. So it was a big leap and it took a while. And Garfield's assassination certainly, I mean, America was slow to adopt it. It spread in Europe. Antisepsis spread in Europe a little bit, but America was a little bit slower. We were coming out of the Civil War. Of
Mhm.
course, nobody wants to slow down an operation in the Civil War. So
Yeah.
fast antisepsis slowed everything down. And that was very weird for the older generation of surgeons who had been taught that speed was a virtue. It does take a while, but it's fascinating to think like who could have lived had they listened to Lister. So I always tell people my kids' book, Dead Ends, the latest kids' book with my husband, is all about medical failure. Because I don't think we talk about failure enough in medicine. Failure is so important because it's not just important, it's essential to scientific progress. And so there's a lot of great, there's some funny stories in there that actually don't lead to anything, but a lot of the stories teach us valuable lessons that then turn us into a different direction and then we solve the mystery. And so I think it's an important lesson for kids and there's a lot of like grisly stuff in there like during the French Revolution they were chopping heads off and doctors were listening, shouting at the heads trying to determine if they still had any kind of conscience and it was a weird time, so there's a lot of fun stories in there and kids love the kind of grisly illustrations that Adrian's brought into it. So if you're looking for a Christmas gift for your kids, there's that and there's a book called Plague Busters, which is about the deadliest diseases in the past and how we solve those problems. There you go. There they are. So we had a lot of fun doing those books for kids.
Yeah,
Yeah.
there's something for everyone, and as we're winding down, we still have a few more questions. I want to thank you again. This has been, just absolutely remarkable. This is one of my favorite episodes. I've learned so much. I couldn't wait to meet you, and it's so valuable for our listeners because we have, patients on here, doctors, people who are just, there's always a new doctor show coming out because that's what everybody loves, medicine and health. It affects everybody. So I would
Why it's so hard for me to convince TV executives. People say the Victorians were morbid. They would get tickets to go to the operating theater. We have so many. I mean, how
yeah,
for ER, like all of these in the pit, which
ER
hasn't.
and then, Grey's Anatomy, like,
the
all
new
that
one,
stuff.
The Pit. I mean, there's
Yeah.
always new shows coming out.
So is
Well,
there
I
gonna
would
be a movie for one of your books?
Yes, so I'm really hoping we're just negotiating with a great screenwriter at the moment. I'm not gonna reveal his name yet, but he really wants to get Facemaker made, and, I
Okay,
just think
awesome.
epic as a movie, and it is an epic story, and there's so many great characters. If people out there haven't read it, one of my favorite quote characters is a French dentist named Charles Valadier, and he's very wealthy, and he's got this Rolls Royce that he literally drives to the front under a hail of bullets. And Vladier is the guy who really shows Harold Gillies that there is this need for facial reconstruction. He's a dentist, so because he's a dentist, he needs medical insight. But it's arguably Gillies who learns a lot more from that relationship. And Gillies brings dentists on board, and it's this huge interdisciplinary effort. And that was really what Gillies brought to the table. Was he brought artists in, he brought all kinds of practitioners, whereas surgeons in the early 20th century really were kind of solitary creatures. They were guarded their kind of area quite aggressively, and they would have looked down on working with dentists or mask makers and stuff. But Gillies had no problem with that, and it was to the strength of the patient because he had this really great interdisciplinary team. And that's also how we start intratracheal anesthesia as well, because his anesthesiologist is the one who solves this problem. If you think about, how would you anesthetize someone who's missing part of their face, it becomes a real problem in the First
yeah.
World War. So it's really his anesthesiologist who solves that. So it's an incredible story. I'd love to see it come to life. And
I would
Harold Gillis has a very famous great nephew named Daniel Gillies. He was in the
Yes.
Vampire Doc. He does the audiobook because I joked to him
I
on Twitter,
saw that.
and he's really good looking, which is like really funny to me that the father of plastic surgery had this like really handsome. And I thought
I'm gonna
that
have
would
to
be.
look him up.
I was like please, because Gillies is kind of an odd looking
Yeah.
person, would make fun of that. He would joke like, if I had had a better, stronger, nose and all this kind of stuff, maybe I would have ended up in a different path, which I think is really funny, and how he thinks like our physical appearance shapes, what we ultimately do with our lives. But I'd love Daniel to, be involved. Maybe, they wreck his face and then like rebuild it into the handsome
That would
face
be
that.
so
That would be
cool.
awesome.
You
Yeah.
gotta you
So
gotta
we
keep pushing it. It would be a massive, massive, massive success. That's something that I hear like Penn Medicine or like an institution like needs to fund or something because it would be a
yeah.
massive success.
Or from your mouth to God's ears, as they say. I mean,
Yeah.
also, I at some point I would love to, because one of the things I work with these other filmmakers, and one of the things that we love to do is something on how plastic surgeons bring beauty into a world that's literally on fire in some cases. So these guys that are going to Ukraine, these teams of doctors who are going to Ukraine, and there's amazing reconstructive work going on around the world, and volunteers doing this kind of stuff. And these,
Yeah.
so the work of Gillies unfortunately continues, and we're seeing the return of trench warfare in certain countries. And so I think there's a good story there too, just about how this comes about, because some of these countries. I was talking to a plastic surgeon who volunteers in Kazakhstan, and he said it's almost like walking into Gillies' world because their techniques are so outdated, and
Mm.
so he's teaching this new generation of plastic surgeons. So it's fascinating that the work of Gillies continues, and is continues to transform people's lives.
Yeah. Well, like we said, we have selfish reasons for wanting to do this interview. We're big fans, but I recommend any listener who's listening, The Facemaker, The Butchering, or Art. All these books are, incredible, and to stay tuned for Sleuthhound, which is going to be coming out as well.
So I'm like, I'm gonna
Mm.
pay you back for those plugs. But yeah, I really delight in bringing these characters to life, these doctors from the past, and I love that doctors themselves are learning like their genealogy. It's like their family.
Exactly.
Yeah. You want to go with our some
Yeah.
quick
Yeah.
questions?
So these are kind of rapid fire quick questions and curious to hear what you think. So who would you love to have dinner with if you could pick any sort of medical historical figure? I'll allow you to say Joseph Lister.
No, I'm not gonna say Lister. I'm gonna say I would like to have dinner with Private Walter Ashworth, who I talked about at the beginning of the segment, who refused to have further surgery with Gillies, because I would love to know how his life had been impacted later. We lose the thread of that because he doesn't write about his experiences or anything. And I would love to know why he decided not to go through with the surgery. His niece said it was because he had made peace with his face, but there might have been a more complicated reason. And I just think like meeting somebody who had lived that experience and could tell me about that would be fascinating.
What's one obscure you have a lot of obscure facts, I'm sure, from all your research, but what's one of your favorite obscure facts that you'd like to tell?
I had touched upon the Listerine thing, and I always tell people I went on a breakfast show in the UK, and they were like, you can't say certain things. It's like breakfast TV, you know? Right off the bat, the presenters were like, what's the grossest thing, that you know? But one of my facts about Listerine was it wasn't invented as a mouthwash. It was actually used to treat gonorrhea in the past.
Wow.
Was named for Lister by the people who invented it were in the lecture hall when he came to America and was trying to convince doctors to adopt antisepsis. So Listerine is kind of like this weird thing that becomes more famous than Lister himself, unfortunately. Although I think Lister's quite famous in Britain, but in America, certainly Listerine takes the cake for the fame. So I love delighting people with that. And I told this on Breakfast TV, and people on Twitter were like, she's telling us to put Listerine on
PSA, we're not recommending.
medical advice, not a real doctor, not real medical. Don't put on gonorrhea.
I know my favorite is Beetlejuice behind you, but what's your favorite prop behind you?
Yeah, tell us,
It's gotta
show
be.
us too.
Yeah, I mean, there's so many weird things here, and I always I'm like, do I keep Bob behind me? I thought you
Yes.
guys would be fun, and I was like, I'll keep it. It depends like how if I'm like with a really crusty, person, you need to be more serious. But I love the Houdini torture water chamber behind me. I use this on set of The Curious Life and Death of. We talked about Houdini's death. He's punched in the gut kind of famously and dies. And it's when I was on set, I said, well, what's going to happen to this prop? And they're like, we're going to demolish it. And I said, no, send it. And so they sent it to me. I couldn't
That's
fit it in,
awesome.
cut it in half. I got it in, reassembled it, turned it into a bookcase. And there's a lot of weird things. I don't know if you can totally see, but there are a lot of weird specimens and weird things in the cabinet. So it's kind of this lighting is a little bit spooky. It gets very dark in England very early. So, but I guess it adds to. I'm kind of
I
a spooky.
love that.
Is Halloween like your favorite holiday?
Love it, but I always have to work on Halloween because people always go, "Oh, let's get that creepy woman who, all this
Yeah,
really
yeah,
upset."
that's true.
So I never get to really enjoy it. And also in Britain, it's not a huge holiday. So someday I want to do like a crazy Halloween to freak everybody out. And this because I live in a little shoe factory village called Wollaston, and this is famously where Doc Martens were first made. And so
Oh, wow.
factories, and it's just a fascinating little place. But I don't know if they're ready for like American Halloween.
What kind of doctor was Doc Martin?
That's a
I'm
good
just
question.
kidding.
Yeah, how did that come about? Doc Martin? Yeah,
Yeah.
yeah, exactly. Not a real doctor.
No.
This whole area has been like shaped by shoe factory, and it's great because they have like little plaques, like the first theater. It's a really cute little area. I'm trying to get on Conan O'Brien's podcast,
Oh,
and
that would be awesome.
he's done this thing where he opens it up to fans, and then one of the questions is like, if I came and visited you, and I said, well, if you came and visited me, we would be like gods because he's so tall and I'm tall for person. And I was like, we could just walk around this like, and he loves history. He did, I think he did his undergrad
Oh,
degree
that'd
at
be
Harvard.
perfect. Yeah.
Point he's going to put me on, but
And you were saying that Dr. Warman sent you something in the
Yes.
past that you wanted
yeah.
to show us. Yeah.
Well, I want to say that Aaron Warman, he reached out to me when I was first starting the Facemaker, and there was an announcement that I was working on this book. And immediately it became clear that he missed his calling. And that's no shade on the fact that he was a fantastic doctor, but he loved medical history and he was a great collector of medical history. And he sent me this vintage golf, so bad at the camera thing, this
That's
vintage,
okay.
yeah, I guess I pushed it that way. So Harold Gillies was a semi professional golfer. And I don't know where he would have found this. I mean, this has to be one of the most obscure things that you could have about Gillies. And on the back, it tells a little bit about Harold Gillies. But he was so kind and he was a great connector of people.
So kind.
I mean, just honestly, and this is how I knew that something was wrong. I got stuck in the US.
Mhm.
Crazy. I tried to get on a British Airways flight. I've lived in Britain for 24 years, and they said they had no proof of my citizenship and they wouldn't let me. So I got stuck in the US for 6
Yeah,
weeks. They told
I wrote a letter.
Yeah, yes, thank you. No,
Of
and
course.
all the way to Parliament. This is the most British thing that ever happened to me, that on the floor of Parliament, they said, "Dr. Lindsey Fitzharris is stuck," and I was like, "This I made it as a British person, like, this is great." And it's all about the story, but I was living in my mom's basement for, like, a good 6 weeks, and the first person I thought to write to about it was Aaron, because he was such a good problem solver, and I thought, "Well, I'm stuck in the States, maybe I can come and do a lecture or something." Write me, and he always wrote almost immediately, and I started to worry, and I was juggling a lot of other stuff, but in the back of my mind I was worried about him because it was so unlike him.
You're so right.
Yeah.
That tells you so much about him, right? That he would instant if he didn't instantly answer your email, you knew
Yes.
something wrong. And so one morning I woke up and I was thinking about him, and I went to his Facebook and there was an announcement, and I was completely shocked. I talked to him about a month earlier. And it really shows you that life,
It's
you gotta grab it while you can, because things can change. He will live on for his humanity as much as Harold Gillies and Joseph Lister did. He touched so many people's lives by connecting people, and those friendships are forged forever. I will always remember his humanity. And I was saying earlier before we started recording that he kind of still lives in my head. Like, it doesn't seem real. I didn't obviously get to go to the funeral or anything. So to me, he's almost still alive. And
Yeah.
hard to kind of reconcile that he was gone so quickly there. But his legacy will certainly live on, an extraordinary person.
Yeah, I just learned two major things about plastic surgery in the last few minutes. One is, the quintessential plastic surgeon is someone who would want to be remembered as a problem solver. And to think that you thought of him that way is one of the biggest compliments you can give a plastic surgeon, because that's kind of what we think of ourselves as. And I was lucky that I got to work with him for about a year in my first year of training there, and I'll always remember that as well. And the other thing I learned from this conversation is typical quintessential plastic surgeon is a wannabe golfer like Gillies. One bad miss, and he's like, I guess I'll go to medical school.
And it's so true. And even when he had bad cases, he'd go out on the golf course and try to clear his mind. I mean, the golfing was a big part of his identity. I guess that's just a doctor thing, isn't it? Like, every
Yeah.
doctor out there on the courses. But yeah, Aaron, he had an extraordinary medical history collection, and really he saved a lot of medical history from being destroyed, because
You're so
people,
right.
yeah, they don't value it, or they throw it out, or
They don't.
whatever. He was a real hunter. I mean, I would have watched a TV show where he was just, like, going around the world trying to find, like, obscure medical his
Yeah.
facts, like weird Indiana Jones, but, like, a medical, like, he was really, he had endless curiosity, and he was so good at bringing people together, and he brought me to the AAPS, which was a wonderful thing he did. It was
Mhm.
right treatment. I'm a freelance writer, so it's, my income had kind of dried up, and so it was like pennies from gold bringing me there, and I got to meet all these extraordinary plastic surgeons like yourselves, and it's just his legacy lives on in every person he contacted, because he was the kind of person that you wouldn't forget. It was always a memorable interaction, and he always did something memorable for you, and that's why when I got stuck in the US, I thought, "Oh, Aaron, he'll know what to do, and maybe I could go over and do some lectures and stuff." And when he didn't answer, I thought something's not right,
Yeah.
because
Yeah.
would almost immediately answer his email, so he'll be deeply missed.
No, I think your heartfelt message about how he's a connector and just humanity is the best way to end this episode, and we can't thank you enough. I mean, this has just been so special to me, and it makes me even more as Hank and I get ready to take off to the first America amphitheater, surgical amphitheater for another podcast. We look forward to hopefully welcoming you to the amphitheater for an in-person podcast. So, and to just come to Penn and talk to all the students, other surgeons, and just to share your wealth of knowledge. And thank you so much.
Thank you so much for having me on.
It was so nice to meet you. Thank you.
Great to meet you guys. Yeah, and I'd love to come back on for Sleuth Hound if you guys would do, like, a
Of course.
100%.
Yes.
copies and stuff, but this has been really fun.
Thank you for listening to The DIEP End, a plastic surgery podcast. If you've enjoyed today's conversation, please like, subscribe, and leave a rating on Apple Music or Spotify. Video from the podcast is available on Instagram and YouTube at The DIEP End Podcast. Join us again soon for more conversations with luminaries and experts in the world of surgery.